According to a 2021 survey, the typical medical student owes $241,000 in student loan debt, which is nearly 6 times the national average. Crippling debt can be extremely overwhelming considering the daunting tasks that can be found in the medical field. Another stress factor in healthcare facilities is the lack of staffing. Because of COVID-19, the quality and accessibility of healthcare has significantly decreased, not only in the United States, but also in the entire world. Even in 2022, many communities are still suffering from a lack of healthcare workers. In order to create a more sustainable healthcare system, we have to focus on expanding and exploring opportunities for people to join the medical workforce. So how can this become a reality? Well, if healthcare facilities paid for their workers' education, they could then expand their personnel to ensure quality healthcare. But first, before looking at the solutions, we must first address the problems at hand. Understaffing in healthcare facilities can lead to heavy workloads, insufficient team collaboration, which includes knowledge as well as training, and also work-related stress. In a study done by BNC in 2020, results showed that stress experienced by registered nurses was primarily from dissatisfaction, insufficient support, and difficulty with work tasks. Quote, the participants experienced too few staff in relation to the number of work duties and patients, which contributed to stress at work. They described how understaffing put tremendous pressure on them, leading to a more significant amount of stress, end quote. In order for this to not happen, we must be proactive in reducing work-related stress. The problem of understaffing is significantly infectious, as it not only affects the individual level, but a whole facility. Another stress inducer in our healthcare system, student debt. According to a nursing economics study, nearly 22% of nursing graduates were dissatisfied, which was significantly related to financial concerns. The people ensuring our health and safety shouldn't have to worry about student debt. We need to look into different programs that not only reduce stress for medical workers, but also give them opportunities to succeed in such a demanding and arduous field. Of course, stress and understaffing can't be completely solved. However, there are solutions to help. Hospitals and medical facilities have began implementing a tuition loan forgiveness program to help students complete their education and join the workforce. UPMC, which is the University of Pittsburgh Medical Center, has started the program described to, quote, help alleviate financial obstacles for students pursuing a medical career, end quote. Starting in 2023, students may receive up to $7,000 in tuition loan forgiveness per semester. The Hershey Medical Center is also doing a similar program, with full-time workers being able to work towards a degree with up to 85% of their tuition being reimbursed. And while this solution is beneficial for both parties, there are other more progressive solutions with bigger impacts. Another way to incentivize people to work in the medical field is by granting them 100% free tuition. The Mercy Medical Center, which is a hospital located in Baltimore, Maryland, has just recently implemented a tuition-free program for 2 or 4-year nursing students. Quote, employees of Mercy Health can receive entirely free tuition for some of the healthcare and health science programs at Mercy College, an institution sponsored by the Catholic hospital system, end quote. The Mercy Medical Center noticed that entry-level nurses were needed the most. So they offered a program that granted free tuition for 2 and 4-year nursing students, so that way they could get entry-level nurses onto in their location. For this program, you must have a certain work commitment, which automatically places people in the front lines. Quote, at the end of a student's program, the hospitals ask for a work commitment of 12 to 18 months, end quote. And I believe that this program could be implemented on a much larger scale, which would have much more major impacts on our healthcare system. In today's society, everyone should have access to the education they need. Increased workload and debt leads to short staffing. However, by rebuilding our healthcare system, we can create a more sustainable one. At the end of the day, we're all in the same scenario. We're all seeking higher education with a crap ton of college debt. Many people in the medical field are in the same situation, with not many having the money to seek higher education. With COVID-19, we've seen the effects of understaffed hospitals, a lack of resources, and hospitals even rejecting medical care because of a lack of bedding or staff. But even in the worst of the worst, there is always a silver lining. By making medical positions more accessible and affordable, we can make our healthcare more accessible and affordable. Thank you.